All right, we'll go ahead and get started. Hello again. My name is Grace Sullivan Zirkle, and I serve as the Associate Director in New Student and Family Programs. And we are very excited to have all of you families here tonight for our very first Parent and Family Orientation session titled Wellness at Duke. A few shopkeeping items, and then we're really going to spend the time hearing from our experts on campus and the opportunity for you all to ask them questions. We do have a variety of folks from all over campus here to give you some insight on what they do and how they support your students. We will have considerable time for you to ask questions. So if you think of them, go ahead and at the bottom of your screen, there should be an option that says Q&A. You can submit your questions there. We will do our very best to get through as many of them as possible. If this serves like, or looks like any of our past webinars, we will have plenty of questions and may have to sort of put some in buckets to get through as many as we can. But again, we're really, really thrilled that you're here. So with that, I am going to call on my colleagues here on screen, and I've asked them to introduce themselves, who they are, what department they're in, and sort of big picture what their department does or their unit does in supporting the wellness of our students here on campus. So I'd love to start with Dr. Lisa Adams.
Hi, thank you, Grace. Lisa Adams, I'm the Director at Counseling and Psychological Services. We call that CAPS for short. We provide counseling for students, assessment, mental health services, referral in the community. Duke Student Insurance covers a large panel of mental health providers in the Durham and surrounding areas. For students, and we also work with all of parents insurance as well to make sure students are getting those services. We have psychiatric care, we do groups, we have individual therapy, and we really work to tailor our services to the individual student. What does this student need? What are these students' needs? We have walk-in hours, so students can walk in or call in, and in the fall, those hours will be 9 to 6 on Monday and Tuesday and 9 to 4 on Wednesday, Thursday, and Friday. So they have a lot of times during the days and early evenings when they can check in with us. And of course, we have emergency services available after hours, and we work very closely with everyone on this call to really work together. Students are whole people. And so we don't sort of slice them off and say, well, this is medical and this is mental health. We really try to work together to really build the best program for students. I'm really excited that you're here, really excited that your students are coming to Duke. We work really hard at Duke to give students a really good experience. And as a parent of a senior in college, yay, senior, I know what a difficult time this is for you guys. And so I just wanted to say hello, and my heart is with you.
Thank you so much. I'm going to go to Lindsay Parker.
Thanks, Grace. Hi, everyone. My name is Lindsay Parker. I'm the Assistant Director in Do Well. And so Do Well, our unit primarily focuses on helping your students practice and engage with wellness. So these opportunities are really immersive and experiential in nature. Things like meditation classes, paint nights, knitting groups, and then we also have conversations with students around harm reduction, which really is a way to say helping them make safer choices around things like alcohol use on campus, relationships, education. And so we'll have more time to kind of talk about what that means and what our offerings are. But like Lisa said, we're glad you're here.
All right, I'm going to go to Tiara Wade.
Hello, everyone. My name is Tiara Wade. I'm the interim director of the Duke Reach office, and our office offers case management services to our students. And so whenever there is a concern about a student or there's a change of behavior, we basically will reach out to them and we will help refer them to resources both on and off campus. We have great connections with many of our campus partners here on this call and not on this call as well. And again, as Lisa said, we also work with the whole student. Whenever a student is usually struggling, it isn't just one issue. It could be their academics, it could be their social group, it could be, feeling lonely about being away from home, just a variety of issues. And so usually our office is a great first stop to just help them figure out, okay, what exactly is happening? What do I need help with? And what are some resources that can be helpful for me? And what we do is we'll let them know about those resources and then even follow up if it's needed.
Thank you. I'm going to go over to Jill Farrington.
Hello, everyone. My name is Jill Farrington. I am the Associate Director of Clinic Operations for Duke Student Health. And Student Health, we are here on campus to help the student take care of their body health-wise. We act as the student's primary care doctor here on campus. We are full service physician office. We offer labs, we offer x-ray. We also manage the students' immunization requirements, and we also manage the student health insurance plan. I do have colleagues here from Student Health, and I'm going to go to them individually because they all have their specialty and depending on what department they're in. So I'm actually going to go to Tony first.
Hi, everyone. Welcome to Duke. Your students are coming, but you're coming too, so welcome. So I'm one of the campus nutritionists. I play a role in two different capacities at Duke. I work with Duke Student Health. There are two nutritionists on staff. And we can work with students to see them one-on-one for nutrition counseling. They can self-refer. Sometimes our other colleagues on this call we work closely with may refer them to us. Community providers may refer them to us. So that is all covered by your student health fee. My second hat that I wear is I work with Duke Dining. And I work very closely with helping them manage their food allergen and special dietary needs program. So I will be able to answer any questions for you regarding any special dietary needs that your student has, or do my best to explain the Duke Dining policies to you if I can. How that works, and one of my colleagues from Duke Dining is going to try to join the call in a little bit. So I'll just echo what everyone else said and say welcome.
Thank you, Tony. I'm going to move over now to Ellen Crawford. She is our immunization coordinator, and after Ellen, we'll go to Calvin. They're in the same room together. He's our insurance coordinator.
Hi, everybody. Welcome to Duke. My name is Ellen Crawford, as Jill mentioned. I am the immunization coordinator, so I am the one who will hopefully be able to help you with any questions you have regarding the immunization compliance. The state of North Carolina does require that every student submit certain immunizations to Duke and be up to date on certain immunizations by the 30th day of class. So hopefully by now you guys have gotten started on that process, and I'm here to help you with that. We are also planning on being available to you on move-in day if you have any questions or have any vaccines and TB testing that you will need on that day. We will have some time on that day, as well as during your orientation week and the first week of class. So again, welcome, and I'll let Calvin come into the square here.
Hello, everyone. I'm Calvin Vini, the Medical and Dental Insurance Care Specialist here at the university. My job basically here is to answer any insurance-related questions, to help enroll into the insurance, and to give a better understanding about how the insurance process works. From the time that you actually use the insurance for doctor's appointments, or if you go to the dentist, my job is to basically help you to understand or give you a lesser version that's easier for you to comprehend exactly how the process works.
Amazing. Thank you all. I know that was a quick intro to who you are and what you all do. but I'm going to ask a broader question and allow anyone to jump in as they see fit. So if we're thinking about these new families that we have here on the call, and thinking about how we might want to partner with them in their students' journey over the next 4 years, what do you want new parents to know as we think about partnering with them? What else do you want to share in your shop?
I can go first. I think the main thing is, there's, it's very confusing time, I think, as you have, especially a student moving from high school or A levels on to college. And so I think that there's that piece, where they're 18 years old and now all their medical records are confidential and all of that. But the phone does work, and you can call, and we can listen. And we can, some of these folks aren't under the same confidentiality as we are, but I think it's just important for you to know that we are partners in this with you. If you have a concern about your student, if you're, concerned that your student's maybe not following up as you hope they would, and that kind of thing. And we're here to sort of help walk you through that, get you to the right place, reach out to students, we work together to do these kind of things. And so it's, I know it's it can be kind of daunting to sort of have your student go off to college that first semester. And so I might be projecting when I say that just a little bit, but I think that, that we're here to help you guys kind of navigate through that. So we really are partners for you in that. You can call or email and just let us know your concerns, and we can sort of help you problem solve about what's the best way to take care of your student.
I'm just going to jump in real quick, Grace, and say, I think that one of the hard things too for new families is that, at least in the student health world, once the student is 18, we really aren't allowed to speak with the parents anymore. So I think a couple of things to keep in mind. We send a lot of emails out to the students that the parents don't necessarily get, especially regarding insurance and immunization and other things. So I think it's really important to encourage your students to check their Duke email. And I know that's kind of hard now. They're transitioning from high school and into college, but the information that we're sending to them is going to their Duke email addresses. So I would just encourage everyone to have their students, periodically check that Duke email to see what may be going on and what information they may be receiving, because it's usually pretty important stuff.
Something that I would add in for parents and families, really from a foundational and preventative sort of standpoint, is really talking with your student around prioritizing eating, sleeping, and doing the things that bring them energy. Definitely in our work, we notice that when they are stressed or anxious, have a lot going on, those really, really key pieces are the first to go. And that can sort of set off a domino effect, which might trigger them to see one of the people in this room, but really making sure they're scheduling time to eat and sleep, as elementary as it sounds, is really, really critical. And we talk to students about that a lot.
I just want to echo what Lisa and Lindsay have said, and just let all the families know that we are here to help your student transition into adulthood. One thing that we talk about in student health is that teaching moment, because we all know once you transition into adulthood, healthcare, insurance, anything like that can be frightening, right? Even to the adults in the room that's been out in the working force for a long time, it can be a little scary. So what we like to do is have those teaching moments so we can give a foundation to the students and help them along with their healthcare. I would also like to say that it's important for all the students to know that we are here. Everyone in the wellness building, we are here. The students do pay a health fee, and that health fee gives them access to every office in the wellness center. We all work together. We will all partner together. I would just reiterate that the students utilize us. Utilize us to stay healthy. Utilize us if you have questions. Even if you're not sure if you have a question, we are all here. We are here to take care of you. So just utilize us. Encourage your new incoming students to call on us for anything.
I'll go ahead and add that just again, speaking from the Duke Dunning perspective, in terms of any special dietary needs, we can do our part in terms of food safety, food labeling, but the part that we need students to do is to communicate with us each and every time that they're ordering their food. It's really important that they take responsibility, and sort of that shift goes from a parent responsibility, which is really, really difficult, I know, but to encourage them to ask the questions. Sometimes they feel like they're going to be a bother. They're never a bother. It is our job to help them feel included and supported and safe when they're dining with us. And I can promise you, we can do that. We've got layers and layers of opportunities and information for them, from right when they're ordering their food to online to people they can identify directly when they go buy their food to ask questions if they don't want to read anything. So we can help. They just need to do their part and let us know so that we can continue to help support them.
Amazing. I'm just making sure I'm not cutting anyone off before I go to some Q&A. That was wonderful. I'm so glad we asked that question of all of you. And I think your answers really reflect the integrated support system that's here, right? Approaching wellness from multiple dimensions in multiple areas on campus. We do have a bunch of questions that are coming in. I'm going to do my best to group some that are similar. So I'm going to start with some insurance questions. And wondering if we can walk through sort of broadly, how do families figure out if their insurance is accepted and how they could go through the waiver process? And once they're finished the waiver process, is there a delay in when that charge for health insurance would be removed from the student's bill?
Okay, so for starters, about the charge being waived. If the student is issued an insurance waiver, and I normally say 3 to 5 business days to have the charge removed off of the account, which the bursar is really good about removing it sooner than that. But just to be on the safe side, we always say 3 to 5 business days for either the insurance charge or health fee to be removed, depending on the student's situation. Now, as far as the insurance waiver goes, to check to see if your insurance will meet the Duke Health waiver requirements, if you go to Google in the search bar and type in Plan for Duke, so PLANFOR and then Duke. If you put that in, you should see a link that says Accepted Health Insurances by Duke Health. Once you click that link, it gives a list of all the major insurance carriers that Duke Health is a participating provider with. Cigna, Aetna, Humana, Blue Cross Blue Shield, United Healthcare, all the policies that we accept are listed on that list. So that's how we determine on if we can accept it. One thing it doesn't account for is that if you're under a third-party insurance carrier through your employer, but your insurance is underwritten by a major carrier. So example, you may see on the front of your insurance card, it may say Joe and Pat's Insurance from Texas. Of course, on the list, it's not going to say Joe and Pat's Insurance. On the insurance card itself, you should see underneath somewhere where it may say Aetna PPO outside of the network, or Cigna or Blue Cross Blue Shield or United Healthcare. That is what we're looking for, is that underwritten major insurance carrier. Under that, if you look and see Aetna PPO, you can check the list and Aetna PPO will be on the approved list. So if it's submitted as Aetna PPO, then of course the system will recognize it, and then of course the charge will come off. But if you're using third-party names, the insurance request may deny, but then we would have to research the insurance information, which you can send us a front and back copy of the insurance card for us to verify. Once we verify with your insurance carrier, we give you the name of the person we spoke to and a reference number for the phone call. So if there's ever any dispute, the reference number can go back and pull the entire phone call so they know who said what during the phone call. So that's how we determine on if the waiver is approved, and even if the waiver denies, there still may be a chance for us to approve the waiver based on what the representative tells us.
Amazing. I want to transition a little bit to student health fee, right? So there's this question about if they don't have Duke insurance, are services still covered? And sort of what services are covered by the student health fee broadly? Maybe that's a Jill question.
I'm sorry,
Go for
I can answer that too. So the student health fee is charged to all students that live on campus or reside within a 50-mile radius. Students that are 50 miles or more away from Duke's campus, online or distance learner outside the Durham area, or study abroad students, or and School of Medicine, School of Nursing students that complete all their classes in the hospital setting are the only students that can have that health fee waived off their account. The health fee allows the student access to Duke Student Health, CAPS, Counseling and Psychological Services, Duke Well, and Duke Reach. In essence, it's like a semester-long copay. So there's no charge to the student to use those services. The only time at Student Health that we would bill the students insurance is if they're getting labs, vaccines or travel vaccines, or if they're getting x-rays, because we have an x-ray machine in-house. Those are the only 3 times we bill insurance. So for a student to come in and get checked for strep throat, pink eye, cold, flu, sinus, minor aches and pains, cuts and bruises, there's no charge to the insurance carrier.
Thank you so much. One more about insurance, and then we'll pause on insurance for a minute and ask other questions. Can a student buy dental insurance if they waive the medical insurance?
Yes, the dental insurance is an optional service. They can go into their Duke Hub account. There should be, under forms and requests, there should be a link for them to enroll into the dental insurance. The dental insurance cost is $275, but that's for the entire year. And the students are granted a $2,000 budget. So with Bright Smiles or Bright Benefits, they have preset charges of what services are. So if you are getting services done downstairs at Campus Smiles Dental, those preset charges is an agreed amount between Bright Smiles and Campus Smiles. So there's no additional charge that comes out of the student's pocket. It all comes out of that $2,000 budget. Now, if you see a dental carrier away from Campus Smiles, then you can still use that dental carrier because there's no such thing as in or out of network with the dental insurance. It's just that if the charge goes over the preset amount, then the student or member is responsible for the remaining balance, not the preset dollar amount. And of course, like I said, that comes out of that $2,000 budget. So that has started on July the 1st. Enrollment started July 1st and it ends August the 31st, and it will start with an August 1st start date.
Thank you.
You're welcome.
What about the pharmacy? Can someone talk about the pharmacy as a service and how students would go about using that for their prescriptions?
Student Health has there's a pharmacy in the Student Wellness building. It's on the 1st floor. And the best thing to do is, if you presently have prescriptions at your home pharmacy, is to have those transferred from pharmacy to pharmacy. Once the students are here and they are being seen at Student Health by our providers and need prescriptions filled, they can do that right here by just going downstairs and filling the prescriptions there.
Thanks, Ellen. We have a few questions from families whose students have a pre-existing condition or a need for specific medical care, like physical therapy, beginning right when they get here. How can they figure out how to start that and who to see here at Duke or in the Durham area?
I think I can answer this one too. So when students are coming in, if they have pre-existing medical condition or chronic illnesses, diabetes, cancer treatments, anything like that, what we normally tend to do is ask the student to supply medical records or documentation about what their illnesses are. The student can then schedule an appointment with Student Health, meet with our providers. That information is then added to the provider notes from Student Health, and then we can help the student schedule the appointments with the specialty providers based on their class schedule, so they don't have to miss classes. There is PT inside of the Student Wellness building upstairs on the 3rd floor. They normally have readily available appointments where students can get in. They don't have far to go. They're literally just walking right up the steps or catching an elevator if they're on crutches or something like that. We don't want them walking. But that is also located in the student wellness building. But like I said, the clinical notes from their primary care physicians or specialty doctors that they've seen outside of Duke helps with them, with the specialty providers, because it gives a history of the services that were done for the student for these chronic illnesses or injuries or surgeries. So that way the providers at Duke will know how to treat the student. They're not starting fresh. They're basically doing a continuity of care. But in order to get to the Duke specialty providers, they would have to come through student health, because the Duke specialty providers normally don't see students that haven't gone through student health. It's just a way for them to track the provider notes or the clinical notes, so they can submit all that information to the insurance carriers. So all that information is on file.
Does the student health insurance or student health fee cover therapy services? And maybe we can transition then into what more therapy services are available through Duke.
Are you talking about like mental health therapy, that one? Okay. So there are no charges for any of the services in CAPS. It's all part of the student health fee. And so you will have already paid for it when you pay the student health fee. And I'm really proud of that. I'm really glad that we can do that. So you don't need your insurance from home unless your student, let's say they're coming to school and they already have a diagnosis of bipolar disorder, an eating disorder, something like that, that's going to need like long-term treatment from a specialty provider. They can still come to CAPS and we will do an assessment with them. And then we can recommend specialty providers in the community that can work with them on those particular things. The majority of our services are, I would say, brief therapy. And brief, it varies based on student need. But if we know a student is going to need or likely to need 3 or 4 years of support, which many students do, we will work really hard to get them connected well in the community. And then that's where your insurance would come into play. And we will work with the student too to sort of figure that out. To figure out, who takes their insurance and how to get them in. And we'll follow up with the student until they get connected with the right provider in the community. And sometimes it takes a couple of tries to get the right person. It's all about fit when it comes to psychotherapy. So that's something that we'll work with students on. But the majority of our students are served really well through CAPS, can be served really well through CAPS, and that would be no additional charge.
I'm going to read this one verbatim. A parent says, "Thank you. This is all wonderful. I have a son coming, the youngest of 3 boys, none of whom are inclined to seek out services such as DoWell or CAPS, yet no doubt they have needed them. Is there anything in specific you do with the intention of getting young men comfortable in these spaces?" And I would also think about maybe extending to Duke Reach too. How are you all thinking about getting your message out and bringing more people in for sort of preventative care?
I can start with this one and then pass it to Tiara and Lisa to chime in. I think this is a really great question, Karen. We definitely do see that male identified students engage with our services a little bit less than their female identified counterparts. We do a couple of things, at least in my office, and I also know that both CAPS and Duke Reach do a lot of this, but outreach, right? Getting face-to-face with students to tell them about our services, to really begin to normalize that process, to destigmatize it. That's why we really encourage folks to come to the space too, before they really need it. So they're comfortable with it. So in the moment, it doesn't feel like quite so much. In addition to that, I'd also add that a number of our events in DoWell, for example, we intentionally design them to appeal to a wide variety of audiences, right? So for example, our drumming that we offer once a week, that's really popular among guys on campus. And we continue to add new services that men tell us they want. We've got a men's engagement group. that we do a lot of work with them there and will continue to do things. And rest assured that we let students know about this through a variety of means, whether it's our Wellness Wednesday newsletter on Instagram, through DSG's Blast, right? Like they're going to see it in a lot of places. And so we hope that that will kind of begin to address some of what you describe. But I'll kind of kick it to Tiara and Lisa if there are other things they'd like to add.
Yeah, so in our office, there's a variety of ways that students get in touch with us. And a lot of times we have students that refer other students or students that refer themselves. And of course, we do a lot of outreach, letting people know about the services that we offer and that we're available, and that, we're able to have conversations to figure out, what students' needs are and what resources might be best. We also make sure that, our staff is diverse and kind of reflects the student body. So therefore, if there's, someone with a certain identity they're more comfortable meeting with, we have people available that can, maybe they might be more comfortable speaking with, depending on that. And also just continuing to kind of give that message that it's okay to seek services and to get help. And also helping students to have those kind of conversations with one another. So if they're concerned about their friend or their classmate, or they've noticed a change in behavior and they're not quite sure what to do, how to have that conversation about checking in with that person and letting them know about what resources are available and who they can see on campus for help.
These guys did an awesome job. I don't have a lot to add, but I will say that I think that, I think the message that, mental health is not just for women is a really important message. And so it's one that we continue to sort of problem solve around, and getting out there to groups of students that are primarily male is really important. And so we're working on that very vigorously. I think we can always do better with that. And the other thing that Tiara said that I think bears repeating is that we work really hard to make sure that our staffs are diverse and reflect a wide variety of people. So we have a number of men and people of color and people of all kinds of different identities on our staff, so that students can see themselves in our staffs and feel comfortable walking through the door. It takes a lot of courage to ask for help, any kind of help really, but particularly mental health help in our culture. And so we know that, and we work every day very hard to sort of break those barriers down for students. So I really do appreciate that question and your mother's heart in that question.
And I'll just chime in here in terms of us. I think everyone on this call would agree that we think of whole person wellness. And so if someone is coming in to see me, and we see a lot of male identified students coming for nutrition information, whether it's about, sport, healthy eating, whatever it may be. And we oftentimes will pick up on some other little triggers that might be, gosh, this might be a stress issue, and we can work with them for a while and very easily sort of transition them to maybe working with someone at Do Well, working with someone at CAPS, of course, using Duke Reach if we need to. But we all sort of interact with each other and are able to facilitate helping students who may not feel comfortable making those connections that they need.
Tony, while we're on the subject, I wondered if you could talk a little bit more about how you do outreach broadly. How do students know about and come to get support from nutrition services, but also their dietary needs?
Yeah, so from the nutrition, from the student health and wellness hat I'll put on now, we do a lot of outreach and information providing through social media. We have on the wellness Facebook page and newsletter, there's something we do called Tuesday Tips, which is always a nutrition tip. We have an extensive page on the nutrition website, on the student health website, that's nutrition related, that's got all kinds of videos, nutrition-related health information, recipes you can cook in your dorm room, you name it, we've got that sort of thing there. We partner with wellness to do events on campus through Duke Dining. We do educational opportunities and that kind of outreach at point of service. We'll do a couple of big campaigns a year that way. So we get referrals from all these beautiful faces on this screen. We get referrals from community. Our providers at Student Health are very aware of the importance of nutrition and wellness, and will often, refer students to us, even if it's just, gosh, I'm feeling a little bit tired, hey, go see the nutritionist, you've got access. So we try to get them wherever we can, and we're always thinking of new ways. So I hope that answers the question.
I'll ask one more while I'm on it. Tony,
Okay.
I think there's questions about, will my student be the only one? Do you know if there's a sizable group of students who are vegan?
Yes, I would say we're a really vegetarian, vegan friendly campus. We actually have an all vegan cafe on West Campus, and then at Marketplace, where most of the freshmen eat, or all of them eat their board plan, there's an actual completely vegan station there. But any place that you eat on campus or your student eats on campus, we have vegan options, and we label again for that trait, and there's a little V+ on all of the vegan options on campus. I would encourage you to look at the Duke Dining website and look under nutrition information. You can pull up menus and you can search, actually filter out for all the vegan options on campus. Now, it's not all of the cafes are menus are up right now, because not everyone is open over the summer, because we've got a smaller community on campus right now. But yeah, lots and lots. And if there's something that is missing, we can try to add that if we can.
Thanks, Tony. There's a general question about if a student needs medical care that's non-emergency, how do they approach that? How do they get medical support on campus? How would they access care, I guess, is the question.
Student Health is available to the students. We're open every day, except that we're open Monday through Friday. They can call. We do not have a walk-in clinic, but you can always call. The students can call and either schedule an appointment to be seen or talk to one of our triage nurses. The triage nurses are great, and they can talk the student through the symptoms and what's going on with them, and help them to determine whether they just need some advice on home care, or whether they need to be seen here at Student Health with an appointment, or if they indeed do need to go to an urgent care or into an ER setting. There are quite a few urgent cares in Durham that are open all of the time. So that is around. The thing I think that we find a lot with the first year students is, as Jill was saying earlier, or someone was saying earlier, this is kind of a new experience for the students, and sometimes they don't really know what to do with themselves if they wake up and their throat's a little sore. They don't have anybody to help them through that, whether this is just I slept funny, or I didn't get enough sleep, or gee, do I need a strep test? So the triage nurses here are great, and they can help the student work through those things. After hours, the triage line is open 24 hours a day. So there is a number that they can call to also get advice when Student Health is closed, and they will help them work through the same issues, either giving them some home advice, scheduling them for an appointment the next day, or sending them to urgent care if need be.
Thanks so much. Another question, so those who are on payment plans will start paying tuition soon. So if the health insurance fee is not off of their bill yet, what happens when those payments are start to be due? Is there a refund? How does that work?
Well, any kind of credits or refunds get reimbursed to student health, so we can have a party with your money. No, I'm kidding. So what tends to happen is our deadline is longer than the bursar's deadline. So our deadline is September the 15th, where the bursar's deadline may be August the 1st. With that being said, if you schedule payment plans with the bursar's office, they'll bypass their deadline. If you want to make your payment in full by August the 1st, that's fine. You can do that minus the insurance charge if you're submitting for a waiver. Now, keep in mind, if your waiver is not approved, of course, that charge is going to stick and your student's going to be enrolled. But because, like I said, our deadline is longer than the bursar's deadline, you can make any payments that you want to, minus the insurance charge.
Thanks so much.
Now, I'm sorry, just one quick thing too. You can also reach out to the bursar's office and have your payments distributed the way you want them to be distributed. So for instance, if you are want to pay just the insurance, if you want to pay that insurance completely off and then you work on payment plans for everything else, you can designate that with the bursar's office and they'll structure your payment how you would want your payment structured, as long as you make your payments like you're supposed to. So they're not limited to just one specific item. You can limit it to one item and then work on the rest of it, or you can designate it to say, hey, look, here's my payment. Apply it however you see fit, just to make sure the bill is zero balance or paid in full. But that's something that you would have to work out between the bursar's office. But just keep in mind that our insurance deadline is September the 15th. So as long as all insurance information is submitted by September the 15th, at least submit it on or by September the 15th, you're good to go. So if it's a little past September the 15th before you get a response to us, please do not go into panic mode. We can always have it fixed. You just have to keep in mind that we are in the middle of the enrollment period, and there's 16, 17,000 students that we're dealing with all at one time. So it's not going to be, it may not be a fast process, but we will take care of it.
Thanks so much. I know we've got more questions. We're going to get through as many more as we can in the next 15 minutes. One of them, I'll put two together, which is sort of, if a student is under 18, so they're 17, is there anything families need to do to authorize care? And then I'm going to group another one together. How does a family member go about contacting student health if they have questions broadly?
So I guess I'll take that one. If we have students that are under the age of 18 when they enter into the university, there is a parent authorization form that the parent can complete that will give us access to treat the student when they show up at student health. That authorization form is good until the student turns 18. Once the student turns 18, they can consent for themselves to be seen at student health. If a parent has a question regarding their student's care, if they're under 18, they can give us a call at our main number. I would press option 2 to speak one of the triage nurses, and they can walk you through any questions that you may have. If your student is over the age of 18, you can give our office a call, but what will happen is the nurse will ask that either have the student give us a call and we can get permission from the student to talk to the parent, or the student may elect to schedule a visit with one of our providers and invite their parent to come in. And at that time, they can give verbal authorization for the information to be given to the parent. But once the student turns 18, by HIPAA laws, we are not allowed to give out any kind of information unless the student has given permission.
Perfect follow-up, Jill. So to clarify, is there a proxy health setup which would allow families, if their student consents, to log in and see their health information?
There is a proxy account that can be made, that has to be made through Duke Health. There's a Duke Health website that you would have to go on to fill out for there to be proxy access. That's not something that we can give you at Student Health, but there is a way to get proxy access.
Thank you. Regarding prescriptions, what happens with existing prescriptions that can't have refills, like controlled substances like ADHD medications? Is that as simple as an out-of-state doctor allowing it to be sent to Duke Pharmacy monthly as needed?
The best thing for the student to do would be to come in and set up established care with one of our providers here. And that way they will be in our system and have a relationship with the providers here to help them through that. And they would be able to prescribe those medications and get them here. To answer your question about transferring it from another state into our pharmacy, I would recommend that you call our pharmacy and ask what those rules are for that. And that would be the Duke campus pharmacy.
For our students who need urgent care need outside of normal hours at Student Health, how do students without vehicles usually get to urgent care or get that? I guess this could happen non-urgent care, right? How do people without vehicles get to services off campus as needed? What do we typically see?
Typically, if the student needs to be seen outside of hours and they need to be seen at an urgent care facility, it is on the student and the family to be able to get the student to our urgent care setting. So students may utilize Uber to get there. That is not something that we are responsible for. As far as transportation, it would definitely be up to the student to be able to get to the urgent care setting.
Thank you, Jill. I'm going to ask a broad question as we get towards the end of our time. But I want to provide any of you who want an opportunity to talk more specifically about some of your signature services or ways in which you see commonly that you interact with first-year students in more detail that we haven't been able to talk about yet. So brag on your awesome signature services and ways that you students often use your office's support.
I can brag a little bit. We have a fantastic staff at CAPS, people from all over who have all kinds of training. Everybody in our office is a specialist in college student mental health, and they want to be here. This is a job that you love and not a job that you do for money. Sorry. I don't know why I choked on those words. So I think that that I just want to say that we also have people who have specialties in other kinds of things as well, even though we don't provide, depth of specialty services. I've got folks who are doing research in neurodivergence and in depression treatment and all kinds of other things like that. So we have some really good ability to help serve students who may have some of those kinds of issues. And so CAPS is always a work in progress. But Duke resources CAPS really well. And so I'm very proud of the services that we have and the services that we're building for students. That's my brag.
I guess maybe I'll go next, and I'll love to brag on student health. I will say that, as Ellen stated earlier when we came on, the state of North Carolina requires that all students are compliant with their immunizations by the 30th day of class. And I would like everyone to know that those first 2 weeks or so, when school is starting, you will find all of the staff from the director all the way down to the front desk. All of us are on board in Penn Pavilion to help administer those vaccines, from the check-in process all the way to drawing blood. All of us share in making sure that your student gets the vaccines or the immunizations that they need. Also, we have awesome staff that will do travel medicine as the year goes on, and our nurses actually research the countries that the students are going to, and we make recommendations. We offer the travel visits where we will actually talk to the student about where they're going, what they should look out for, and the safety. And then we finish that visit up with a provider to make sure that they are receiving the vaccines that they need. So I would like to say that student health, we're here depending on what time of year it is, depends on what services we will offer. We also have a connection with the Department of Family Medicine at Duke. And with that, we have providers that actually come over and they give sports medicine care. We also have providers that do transgender care. And we also have an endocrinologist that actually comes over to help us give care to the student.
That's awesome, Jill. I would like to highlight kind of two of our signature services in Do Well. One being Koru, which is our 4-week meditation and mindfulness class. It's really popular among students. We offer in-person and virtual courses. And the beauty of these courses is students can really learn some good meditative skills that ultimately help them kind of cope with stress, anxiety, a part of this becoming who they are process. We have really incredible numbers for that program and great feedback on it. So even if it doesn't sound like your student's cup of tea, we'd encourage them to try it out. At worst, it's a great way to meet people, right? And then the other kind of signature program that we offer is our Moments of Mindfulness programming. So those happen Monday through Friday in different spots on campus, although almost all of them occur in the Wellness Center. And again, these events, paint night, yoga, knitting, Tai Chi, appeal to a large variety of students, kind of depending on their interest. They don't have to schedule it ahead of time, so they can just pop in when their schedule allows. And students' feedback tell us that they really appreciate this flexibility. And again, it's another great way for them to meet students, make those connections, in addition to prioritizing their wellness and really getting to see the space before they reach that critical point. And in just a second, I'll drop the links in the chat too, so you can learn more about them.
I want to just jump in and piggyback on one thing that Jill said about the immunization process, because I know it can be very stressful for families coming in. The one thing a couple things I want to encourage you to do is, as we were talking about earlier, making sure your student is checking their Duke email. The way we communicate with your student regarding the immunization process is that we send them a message through their Student Health Gateway after we look at their records and review their records. And these messages outline specifically what is needed for immunization compliance. So we don't want there to be any surprises on move-in day if you get here and you're kind of flagged to come see one of us that day. So just encourage them to keep an eye on their email. They'll get a Duke email that says, you've gotten a message, please log into your Student Health Gateway. We do have a lot of records we're processing right now, so it's taking about 2 to 3 weeks to get through the records once your student submits them. But again, I would just encourage you to have them try to get in the habit of looking at their email and making sure they are aware of any messages that we're sending to them.
And I like to piggyback off of Ellen as well with emails. As far as, well, the enrollment period started June the 15th. So your student received an email through their Duke Hub or their Duke email account that said, welcome to the 2022-2023 school year. It is now open for fall enrollment. More communication is going to be coming soon. 2 days later, they got an email, their first email that gives them the instructions on how to enroll or waive the Duke SMIP. Every week, they're going to get a follow-up reminder email until they complete the process. So from now until September the 15th, they'll get an email just reminding them, hey, little Timmy, you haven't submitted your information, please do so, or this could happen if you don't. And then they'll get another reminder, hey, little Timmy, remember, don't forget about us now. September the 15th is the cutoff date. Then they'll get another email. Like I said, they'll get constant reminders to complete the steps. Until the steps are completed, then they won't receive any more emails. So please, please, please check your emails, because we can tell if you've opened the emails or not. And also the emails are date and time stamped down to the second. So we can tell if little Timmy opens the email or if he decided he wanted to ghost us because he would rather have a party life. To make it more easier, please check your Duke email or have your student check their Duke emails to make sure that they're getting all the communications. So that way they don't miss anything that's important. We're also willing to work with the students. So that way, if a situation arises, it could be a tech issue or something like that, we can have the deadlines extended a little bit because, of course, tech issues aren't their fault. But they have to communicate that information to us. They can't just blow it off and then come back later and say that I never got it or I had a tech issue, so I couldn't do it. So as long as they communicate with us, we're very open to help them out the best that we can.
I'll just very quickly add that nutrition services, again, are covered by your student health fee. So that can be a very big expense out in the community. So encourage your students to come and see us. And I will drop a link in the chat as to how they can schedule appointments with us. And then just to very, very quickly say that we offer both virtual and in-person appointments. So sometimes the students prefer the virtual because it's just easier with their schedule. And that's, I'll let someone else talk now.
I want to hit 2 quick things before we wrap up, and I'm going to call both of them out and then let y'all answer. Tara, from the Duke Reach lens, we know that families are often contacting Duke Reach if they have a concern about their student. Can you talk through sort of what that looks like, why families reach out, and how you all field those concerns? And then Dr. Adams, I'm going to have you talk about telemental health, which we haven't talked about yet in this session.
Yes, thank you. So families reach out to us for a variety of reasons when they might be concerned about their child, or they haven't heard of them in a while, or they just notice some changes in behavior or things that they're concerned about. Maybe they don't feel like their student is, connecting like they should, or maybe they mentioned they're struggling with the class. And they can let our office know. We have our email at Duke Reach, I'll put it in the chat, and also our phone number where you can contact us. And then, we can reach out to your student. We also could send someone by their room. And a lot of times, just to add some advice, parents will say, I'm concerned about my student, but I don't want them to know I'm concerned. And they just want us to have a staff member stop by. And that's not always helpful, because a lot of times the staff member will stop by, but I'm thinking like the RA or somebody in the housing team, and they'll just say, oh, I'm doing fine. So it's okay for you to let your child know that you're concerned about them, and let them know that you've reached out to some resources, and that somebody from the Duke Reach office might be reaching out, or you might recommend to them a certain resource that you think might be helpful. But it's okay to let them know that you're concerned. And if there's an after hours concern, then we utilize our on-call system to check in on a student if there's an emergency and we really need to get a hold of them to make sure that they're okay.
Thank you, Tiara. We do provide telemental health services for students, and we have 2 ways that we do that. One is that all of the providers at CAPS, pardon me, can provide services via Zoom or over the phone. But we also have a telemental health provider called Blue Devils Care. And if you go to our website, it's all over the website. And students, there's 2 features for that. They can do ongoing counseling with a licensed provider through Blue Devils Care, weekly therapy sessions, or they can do what's the Talk Now feature. So let's say my anxiety is climbing because I've got like 2 exams this week, and it's just a lot. It's my first year, I'm really, it's just, I feel like everything's got to be perfect this minute. And so there's a feature called Talk Now in Blue Devils Care, and you can just very quickly sign up and get on the telephone with the provider, and they'll sort of help student problem solve through that moment, which is a beautiful thing. If a student is really having a crisis, I just want to reiterate what Tiara said about the Duke on call after hours. That's probably the best way to go there. But so we have several different ways that students can reach out, and we bombard them with this information, so much so that they can't remember any of it, but they do get bombarded, and they have all of this information available to them. But the telemental health services are available. Some students love it. Like, I just want to go sit in my car and talk to my therapist right now. Others hate it. Like, if I don't get to be seen in person right now, I'm going to explode. So, we have the whole variety of services available for students, and they can do it the way that they like it. And we're happy to do it that way. Mental health has really changed because of the pandemic, and I think for the better, because we have so much more flexibility in the way we're providing services. So we're able to pass that along to Duke students as well. And it's pretty fun, actually, to sort of redesign it. So we've enjoyed that part.
We are at time, rather, we're 2 minutes over time. So I'm going to call it for this evening. I just want to extend a huge thank you to our campus partners for your time this evening, but even more, right, for caring for our students. And I'm sure our incoming families on the call are appreciative of the care that you will provide in the future for their Duke students. To our families, thank you for joining us. Again, this was the first session of our parent and family orientation this summer. We will continue our series next week, next Wednesday. All of our webinars require individual registration just so that you can get the Zoom link. You can find the full schedule on the Parent and Family webpage, as well as the Parent and Family Blue Book. So we hope that you'll join us again next week and for all of our future webinars. We are recording this. We did record this. If you give us about 48 hours, we'll put it on our website so that you can review and take careful notes about that exact thing that some intelligent person on this call said, so that you can recite it and share it with your student as needed. Thank you all so much for your time this evening. Have a great night.